Welcome back to Grayson Telehealth. Today, we are here to discuss hypotensive symptoms and treatments. A lot of people have history of hypertension and they're taking medications. Likewise, a lot of people have hypotension and wonder, is there really anything like hypotension? Yes, there is. And that is the topic we're here to discuss today, to create the awareness about hypotension. So just like something can be up, it can also be down, and it can also be at the average. So I want us to look at it that way, that the blood pressure can be normal on the average. It can go up and it can go down. So when it's up, it's hypertension. When it's down, it's hypotension. And when it's at its average, it is normal. Okay, so we have hypertension, we have hypotension, we have normal blood pressure. We can say hypotension is a relatively benign condition that most people have, but is under-recognized, mainly because most people that have the condition are asymptomatic. They don't have symptoms, except something happens and they check their blood pressure and figure out that, something is wrong. So I want to give us a background and then go straight to the symptoms and treatment of hypotension. I want to talk about a little bit about blood pressure. When we say blood pressure, what is it? What is blood pressure? So the research shows that blood pressure is the amount of force. Mind you, the heart is like a muscle. It contracts and then it retracts. So blood pressure is the amount of force that your blood uses to get through the arteries. The force, it comes out from the heart and goes into the arteries. And when we talk about blood pressure, we need this pressure to be at a certain level. So when it contracts and goes into the arteries will be able to move them to the rest of the body, the cells, the brain, so we can function normally. So when we talk about blood pressure, we have systolic, we have diastolic blood pressure. Systolic is the upper number. When you check your blood pressure, the upper number is called systolic, okay? And this is exactly the pressure with which your heart contracts or squeezes. When it squeezes that way, it pushes out the blood. And then we have the diastolic, which is the lower number, which is when the heart relaxes and allow return of blood from the rest of the body. The force which the heart pumps the blood or squeezes the blood to the rest of the body, it means a lot. That is what we call blood pressure. When it's too high, it is not good to our health. And when it's too low, it is still not good, even though some have low blood pressure and they move around and they don't feel anything. But at some point, some people have symptomatic hypotension, and that is why it is important to talk about it. So, can our blood pressure be steady? No. Even if it's normal, our blood pressures are influenced by certain factors like what we are doing. If you're exercising and after exercising or taking a long walk, you check your blood pressure, it's not going to be the same like when you just slept or rested for some time and check it. And then your age matters in blood pressure. As you get older, the blood pressure, changes. Medications, if you take certain medications, it can affect your blood pressure. And again, some people have change in their blood pressures with change in positions. It's called postural high pressure. So some people, when they sit and stand, their blood pressure either drops, and some people feel some symptoms, and it's called orthostatic hypotension. Some people, their blood pressure really drops when they get up fast, from sitting position to standing position. And that is when we have orthostatic blood pressure, like I said earlier. So some people will be wondering, what can my blood pressure be? And I'll be like, it's okay. Research shows that an average adult blood pressure should be like 120/80. But then it is still within normal limits if the upper one is maintained below 130. And for some people, based on the medications and their conditions and the age, their care providers may target the upper one to be below 140, but 130 is the most acceptable. And then the lower one to be below 80. Below 90 for some age, and depending on your condition or comorbidities, but 80 and below is most appreciated. And so when do we say that our blood pressure is low? When is it like hypotensive? When you have consistent pressure below 90/60, the upper one below 90, the lower one below 60. Then some people don't have symptoms. If you don't have symptoms, that could be your makeup, your nature. But if you have certain symptoms and your blood pressure is like 90/60 and below, it's time to see your primary care provider or a cardiologist. So what are the symptoms that I may have and think, oh, I need to go see a doctor? And I check my blood pressure. Some symptoms that I may have and feel like, oh, I need to check my blood pressure. Maybe my blood pressure may be low. So mind you, there's no other way to know your blood pressure except to check it, to measure it. Okay, now we have electronic monitors. It makes it easier and it is not very expensive. So I advise every adult to purchase one and just have it in your home. There are a lot of several scenarios that you may just need to check your blood pressure by yourself, and that aids you to take immediate action that can prevent serious conditions like stroke or something like that. If you feel somehow, the first thing that you should do, if you're not diabetic, is to check your blood pressure. And if you're diabetic, you check your blood pressure and you check your blood sugar. So let's go back to some of the things that may cause low blood pressure. Blood loss. If you go to the hospital, some people after accident, they bleed and they get into shock. And one of the signs of shock is the blood pressure is low, or you having diarrhea, you lose a lot of fluid from your system. That can lead to hypotension. If you have any situation that is making you lose water, lose blood, remember, it's going to affect the volume that the heart has to pump out, and it's going to just drop the pressure because the heart doesn't have a lot enough to work with. So dehydration, I earlier mentioned, if you have any condition that is making you lose fluid or water, or if the weather is too hot and you're not getting hydrated, it can lead to hypotension. And then some people have heart problems that affect the muscle contractibility of the heart. So in that case, your heart doesn't have that pressure. It cannot produce enough pressure, pump out the blood to where it's supposed to be. Like some people that have arrhythmias or irregular heartbeats or something like that, they can lead to low blood pressure or hypotension. Again, if you're taking certain medications like antihypertensives, even some depression medicine, some medicine for Parkinson's, or if you're pregnant, or it can affect your pressure and lead to hypotension. So what are the symptoms that I will see, or I will feel, or somebody will tell me, or somebody will tell you that will be like a red flag that, oh my God, let's just check this person's blood pressure. Sometimes, when your blood pressure, mind you, when the heart contracts and push out that blood, it has oxygen. So the oxygen goes through the whole body to the head, to the brain, and the brain needs that oxygen to function well. So what happens if the brain is not getting enough oxygen? Confusion. Mostly those of us that have very elderly, parents that are still lucky to be with us, when they are confused, check their blood pressure, because most of them are no more eating enough. They're not drinking enough either. So confusion, or you have somebody in the hospital that's having issue with bleeding. Even some women, some of us have fibroids, and we bleed through so much every month, and we don't really take care of it. It can cause your blood pressure to be low because you're losing a lot of blood. Again, dizziness, like lightheaded, all these are coming from the brain not getting enough oxygen. Okay. Fainting, you just feel like you're about to pass out because the heart is not doing what it's supposed to do. You need to, pump. Like if you see the pictures, you just see the heart pumping. If it's not being able to pump like that, the other organs are affected because they are not getting enough blood and oxygen to function. So the kidneys, the livers, and the brain and other parts of the body, start to complaint, trying to compensate the little they have. So in some cases it works, in some cases it does not. You feel tired or you weak. That's why some people that are anemic, most of them feel tired and weak. That is a very common complaint from people that are anemic. And then headache. Your head just aches because your blood pressure is low. Yes, it can lead to headache. It can even cause pain, pain of unknown origin. Your neck may be hurting, your back, and you are wondering what is happening. I'm having pain. The body is not getting enough oxygen to sustain the nervous system and the rest of the body. And you may feel nauseous. Yes, if your blood pressure drops, mostly when it drops so quickly, you can feel nausea. Again, your heart may be beating fast. It's called palpitation. You may even hear your heartbeat, boom, 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 boom. Like if you touch here, you will feel it also. So it's called palpitation. And then you can have shock. Yeah, you can have shock. And when you have shock, you don't know what is happening around you anymore. So how can you manage hypotension? Remember, we talked about losing blood, losing fluid, not eating enough, taking certain medications. Those can cause hypotension. That means to treat it or to manage it is the reverse of the points we mentioned earlier. So if you're losing a lot of fluid, drink. Even if you're on your way to the emergency room or to see your doctor, make sure you have enough to drink. Just drink water. If you're not tolerating water, just drink. Okay. If you're dehydrated, stay away from sun and keep yourself hydrated. Just drink to hydrate the body. You see some people when they feel certain way, they drink water and all that, and they feel better. So if you change your position from like sitting to standing and you feel like dizzy or lightheaded, it may mean that your blood pressure drops. When it drops like more than 20 of, the upper one drops like up to 20 or more of what is your norm, that's orthostatic hypotension. That means when you get up too fast, you may feel dizzy, you may even pass out. So if you have noticed this, you have to, be self-conscious when you're changing your position mostly from sitting to standing. You go slow so that you don't fall out. Again, I did talk about changing positions that slowly, even while you're in bed. Be careful. Self-consciousness is very important when you have orthostatic hypotension. Sitting up, standing up cautiously. Eat more. Mostly if we have elderly people around us, or you have a condition or taking certain medication that is affecting your appetite and you're not eating enough, just eat little but more frequently, because the body needs it. The body needs those nutrients to function well. And if you're taking medications, if you're taking certain medications, mostly antihypertensives, make sure you check your blood pressure before you take your medicine. If not, it may drop, to a pathologic level that will give you some symptoms of hypotension. And if you notice that your blood pressure keep dropping when you take your medications, don't fail to go and discuss those symptoms with your care provider. Don't just stay home and continue to take that medicine, or stop and say, I'm not going to take it anymore. It makes my blood pressure to be low. A lot of people stop taking their blood pressure medications because of certain side effects, or just because they don't feel good about it. And that is not healthy, because if your blood pressure remains too high, that's hypertension, and that can lead to stroke. Why hypotension can lead to shock? Hypertension can lead to stroke. Both of them are deadly conditions. You don't want to kill yourself, right? So you have to take care of your blood pressure. That is very, very important. So the doctor may adjust your medication. If you're taking certain milligram, the doctor may bring it down. The doctor may just stop that medication altogether and give you new medications. And again, some of us have been advised to wear compression socks. Why they wear that compression socks is to help reduce the blood from just stagnantly staying on the lower extremities. Because if that happens, the heart will not have enough return to pump out. So that affects the pressure. What happens? Your blood pressure drops, because most of the pressure is just accumulated on the lower part of the body. So we just talked about hypotension. If you have not subscribed to my channel, please do so. And again, share this video to support what I am doing. And you never know who may benefit from it. The essence of this channel is to create health awareness. So it's for you, it's for your neighbors, it's for your family members, and it's for your colleagues and for your friends. So see you in my next video. Again, this is Dr. Victoria Ngozi Ogbuji. Thank you for watching. Did you enjoy what you just watched? Then subscribe to my channel and share this video, because you never know who might benefit from it. I'll be dropping health updates every Wednesdays and Saturdays. So don't miss any. See you next time. Cheers.